Welcome to the Dusty Muffins, where menopause meets sisterhood and strength. We're three menopause specialists coming together to laugh, share, and empower you through the wild ride of menopause and perimenopause. Whether you're curious, confused, or just looking for real talk, you're in the right place. We're here to answer your burning questions, educate, and advocate, all with a dash of humour and a lot of heart. So pull up a chair and join the conversation. Before we dive in, please remember, while we're doctors, we're not your doctors. This podcast is for educational purposes only and is not a substitute for medical advice. We encourage you to partner with your own medical clinician to address your unique health needs. This is the Dusty Muffins.
All right. Hi, everyone. Welcome to the Dusty Muffins podcast. This is episode What to Ask Your Menopause Provider, Getting the Answers That You Need. I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic family physician and a certified menopause practitioner. And I'm here with my two amazing co-hosts.
I'm Aoife.
Oh. Well, hi, Aoife. Maybe I should just introduce you.
I'm Aoife O'Sullivan. I am a board-certified family physician and a Menopause Society certified practitioner here in Portland, Oregon.
Hi, everybody. I'm Dr. Christine Hart Kress. I am a women's health nurse practitioner. I am also a board-certified menopause practitioner, and I am in Northern Virginia.
All right. So who wants to start with what these ladies need to start with just when they're going to seek out a menopause provider? Like, do they come fully loaded with, a journal full of questions? And a lot of them don't even know where to find one. But once they do, where do we go? What do they do?
I think, firstly, if you have a primary care clinician or a GYN doctor, to start there, because the way medicine is at the moment, there are 6, 8, 9 months wait time to see clinicians. And, if you already have somebody who might be able to help you, I think that's a good place to start. So maybe even to contact their office and say, hey, does Dr. So-and-so do menopause care? And then make an appointment solely for that reason, not to cover anything else, but to go in knowing you have that appointment for menopause discussion.
Yeah, I think it's so important to not try to pile that. And I think we talked about that in one of our other episodes about trying to pile that into your annual exam. I think that as a provider, you just need that time. I think one of the things that is really helpful, and I know we love the green climacteric scale, which rates your common menopause symptoms from that you don't have them to mild to moderate to severe, and then you tally up that score. Any score greater than 15 means that you're probably deficient in some hormones and would really benefit. You are deficient and you would really benefit. I think that tool, I think providers, especially those that maybe aren't as comfortable or haven't been trained, at least if you come in with data and specific, here are my specific symptoms and, an objective scorecard. Now, whether they'll know the green climacteric score or not is a different story. So bring the, you can bring the explanation of what the scoring means. But I think bringing your symptoms in something quick and easy, it's a one-pager, and we can actually post that to the notes section for women to have that.
Yeah. I absolutely agree. I think the power of a journal or your note section on your phone for a time amount, whether it be a month or not even that long, depending on how terrible you're feeling, but just to, especially if you're perimenopausal, right? If you're like, listen, that week before my cycle, or if there's some correlation every month that it's happening, then you can record that. You have a journal. You can come then with your green climacteric scale as well with all the information. Because sometimes it's nice to start with your primary care provider so they could just do blood work to rule out maybe all of the other things that it could be, right? And we'll talk about that at some point, but they might be able to rule out some things that then later you can say, okay, this is hormonal for sure, and now I need to find someone who specializes in this.
Yeah. I want to say one word about the tracking thing because, and I'm going to bring her up all the time probably through this podcast because everything is free and I love free. So Dr. Louise Newson is a GP and a menopause doctor in the UK. Her clinics see 4,500 menopausal women every month. And she collects data from all of those visits. And another way she collects data, with your permission, is if you download the free Balance Menopause app and you can track your symptoms in there. And before your visit with your doctor, you can print it out. It prints it out in a beautiful form. And then you bring that with you. And it's not pages and pages of color-coded notes and dreams and whatnot. It's something really good data that your doctor can look at and say, okay, this is helpful, you know? So we can put a link to that in the show notes as well.
Yeah, that's a really good idea.
It is. It's an easy app. I downloaded that back when, I didn't know that I was going crazy. So,
and I think too, having a little bit of a plan, I think so many people, so many women are busy getting their PhD in perimenopause and menopause, and they go to, the M Factor, and they listen to Instagram lives, and they're following people. And I think having a plan, do you want the bioidentical, which is just a marketing tool? We can go into that in an episode, but are you wanting progesterone, estradiol? Are you looking for those hormones that are most like what your ovaries were producing? They're identical. Do you want a patch or a gel? I think having, or a ring. I think having a plan, I think helps providers that maybe aren't as familiar versus going in and saying, give me whatever. I mean, I think if you really, at the end of the day, want a patch and progesterone, just say, I would like 100 milligrams of progesterone, and I would like to start on a patch. I think it's a place to start the conversation versus, maybe someone's not familiar and they're just going to give you the combi patch, and you might have a lot of bleeding if you're not really menopausal, or they're going to give you Prempro, and then you get home and you're like, I didn't want that.
I'm going to make a note for us to do an episode on that, the different types and forms of hormones, so that women can know that going into their doctor.
Yeah,
that's
I like
a great
that.
idea.
And I think on that is, we kind of talked about, like, are your symptoms related to perimenopause and menopause? Those are questions for yourself. The tests, which, we'll go over fully in a different episode, the tests, if you need them, if you don't need them. And then when do you need to be concerned? Because sometimes we get caught up in this, like, everything is perimenopause and everything is menopause. And you know what? Maybe those night sweats are something else that we need to be concerned about. And boy, I don't want to miss, a type B symptom. So those are things too that, a lot of times, sometimes when we get on this, menopause and perimenopause track, we don't want to miss the other things that it could be related to as well.
Yeah.
So, I think, and then we ask, you go in with a set of questions, right? So asking if you're a good candidate or not, and the different types, local versus systemic, any other questions these women should go in with?
Well, based on your personal history, any risks or benefits associated with the hormones,
and I think asking providers, what do they normally prescribe? I think and if they start getting hesitant, I would ask, what are your biases? I think those are, good questions. If you want testosterone, do you prescribe testosterone? Because many providers do not prescribe testosterone because they haven't been trained in it. I think those, and I think it's fair to ask, and we're, are you comfortable? Have you been trained? I think it's fair to ask that.
It's a very Yep,
I
very
think that
fair.
there are some well-meaning providers that prescribe, but then say that, like, I had a patient this week who said the provider's like, look, I know as much about hormone therapy as you do. You probably should go find somebody who knows how to do this. Because I think there are some providers who really want to help women, but they just have, it's, their 99th thing they have to know, and it just isn't what they have learned yet. But they want to support you, but they realize their limitations.
Yeah, that's a strong comment for any, clinician to actually say, I don't know. I love that. I'm not sure, but let's find you someone who can help you.
Yeah, it really does take someone without too much of an ego to say, I don't know. And you're with somebody good then if they can say that, The other thing, just a quick thing about risks and benefits, in general, hormones that we use nowadays are so safe, but there are different options for treatment. And so when I say risks and benefits, what I mean is that sometimes someone will have something in their past medical history or their current medical issue that would help us decide which form to choose. So if you are a smoker, if you're overweight or obese, if you have a history of having a clot in the leg or a clot in the lung or anywhere, I feel like there's another thing I'm forgetting. If you have like a genetic issue like factor V Leiden that puts you at risk of clot, then I wouldn't put a woman like that on oral estrogen, because oral estrogen can increase that risk of clot even further. So you're somebody I would put on a transdermal estrogen, the one that goes through the skin and doesn't change your clot risk. So when I say risks and benefits, I mean based on your personal history. It's very nuanced for each woman that comes in.
And these clinicians that are treating you should know that. They should know that if you have someone who is on thyroid medication, then they shouldn't be taking oral estrogen because it can interfere. So these are all those little things that, your clinician may want to help you, but they've just not been trained, which again is okay. And I think, the other thing is this belief system. I don't believe in hormone therapy. I don't believe in testosterone. I'm only going to give you pellets. You have to take my supplements.
I'm only going to give you the combi patch.
Those are red flags. Run as fast as you can, turn around and go, because it shouldn't be either way. Medicine's not a belief. We give you evidence-based medicine so you can make a shared clinical decision between the two of you.
Such a good thing, to say, because really, if you're going to take care of midlife women, then you have to leave those biases at the door. You've got to get, I don't know. I think as a provider, you can't just say there's one option. But
there's not, right?
When you treat their blood pressure or you treat their yeast infection, I'll give you an easy one in my world, right? You don't have to have the cream. You can have diflucan. We don't have to have a mess for 7 days. So, I think as a provider, and maybe that's one of the things that I've really learned in this midlife care is that you present all the options and let the patient decide what will work for them. The other thing that I think is really important for women, and I see this all the time, is women will get their hormones, right? They'll get them and they're not told how to take them. We have people like progesterone. One of the biggest side effects is it makes you sleepy. And I'll see women that'll come to me for a second opinion. They're like, I was tired. Now I'm always tired. I'm like, well, when are you taking that progesterone? At 7 a.m. Okay.
No.
That's like one, example, of that. And probably my very, very, very favorite is when women, man, they hit the trifecta. They walk out of there with a progesterone. They walk out of there with some estrogen. They walk out of there with some testosterone, and they're just told, go forth and conquer.
Yeah.
And, and then they start slapping everything on, and then they don't know what's working. They start having side effects.
They're bananas. They feel bananas,
right. So I think a red flag is if someone gives you all three and tells you go apply all of them tonight.
Yeah.
I think
that's a red flag. 100%. What was that?
Oh, I was going to say, I have a ton of friends from Ireland who message me saying I paid out of pocket to go see a menopause specialist and they've left me with a handful of prescriptions. I don't know what any of them are and I don't know how to take them. I don't know whether I take them all together at night, in the morning, whatever. So that's actually really common.
Yeah.
In Ireland, even, it's not just me.
Could you imagine giving them blood pressure medication or, go figure it out. I'll see you later. Hopefully it doesn't bottom out. And if it gives you a cough forever, so sorry, suck it up, buttercup. Or, or Cialis, and you're just like, just go figure it out. Take it whenever you want.
It would never
You're going around poking everybody's eyeballs out, So yeah, you have to give instructions and you have to know the instructions in order to get them and in the proper way. And like we said, that hormone stacking. And so there's nothing there. It's lovely to have a phone call, and so if your clinician doesn't give you, a free phone call to first talk to them and tell them about what's going on and what they do, typically you can at least call the office or clinic or an email or a DM and just say, hey, this is what I'm thinking about. This is what I'm looking for. Do you do this? It's at least a place to start, because you don't, especially if you're paying out of pocket, you don't want to, pay an expense and then be, horrifically, just upset and disappointed.
And if your clinician does not practice menopause medicine, then we have some other options too. First step would be to go to the Menopause Society website, where there is a list of clinicians who have either, it's broken up into two parts. So you have to be careful as well. So one is just people who have joined the Menopause Society. And then there's an actual MSCP after their name, which means they have studied for and passed an exam that the Menopause Society set. And so you can put your zip code in there and find out who's around you. Look them up, Google them, see if narrow it down to 2 or 3 people who look like they might suit you, and then make some phone calls, right?
Yep. Yeah. And I would say, that the Menopause Society is a great place to start. Unlike some of the other societies, there's not a vetting process to become a member. So anybody can become a member. And I also think that just because you pass the exam does not make you an expert. It makes you someone who's passed an exam, which, oh, by the way, was the most ridiculous exam that I've taken lots. Oh my God. It was so not bad. Like any exam I've ever taken in all my years.
No.
But, passing an exam does not equate to being an expert. And so I think right now, there's lots of women who have followed the instructions. I found an MSCP, and then they're like, well, they don't know, like they're not that experienced. And so, when I took my exam, and I passed my exam, but it wasn't until I took a very detailed and very course on prescribing hormone therapy, because that exam, studying for it or taking it, only helps you manage primary care. It does not help you prescribe hormone therapy.
And all the different situations of it.
Right. Yeah. It's more about the primary care aspects of midlife care. And so I think asking the question, and this is, I think you have to ask, if you're a nurse practitioner, what kind of nurse practitioner did you go to? If you're a pediatric nurse practitioner, you got 0 time with adults. And adults are not bigger children. Just like if I'm as a women's health nurse practitioner, nobody would let me take care of children. It wasn't in my educational curriculum. It wasn't in my exams. It's not in my continuing education. And I think in some of these spas, radiologists putting in pellets, orthopedic people putting in pellets, and
dermatologists.
And I would ask, what is your background? because if they have not studied adult medicine, that's a big thing. And then if they've, if they're, I mean, I know everybody has to start somewhere. But if you're paying concierge prices, you should have someone that's got some, so in nursing, in nursing, by looking at novice to expert, Benner's model, novice to expert, if you don't have 5 years experience, you cannot even call yourself an expert.
Let's go around the room quickly. Who would any of you say you could have studied that entire book from cover to cover, sat the exam, passed it, and know how to prescribe or take care of menopausal women afterwards? None of us. Everyone's shaking their head. No.
It was all the extra education that we did and still do. Continue
always.
to do every day. Every day we're life learners.
And actually, I swear the answer to every question in that exam was don't use hormones. do everything you can except use hormones. I was so disappointed. I came out of that exam just shaking my head going, what the hell just happened?
Yeah.
I mean, that's our society. That's the society that's fighting for our care and us to move forward. And the answer to everything is basically do everything you can. And as a last resort, you can use hormones. If the benefits outweigh the risks. It's just really disappointing.
It was crazy.
Like, it feels like it was from 20 years ago.
Absolutely.
Yeah. No, I agree with you. And I think, to touch on what Christine was saying too, is it's really hard because everyone's an expert, right? Everyone there's, you can go get a certificate in 2 weeks or a month or whatever it is and call yourself a doctor or call yourself, an expert.
A practitioner.
A practitioner. I don't even know what that means anymore. So, it was funny. I was talking to someone about this and I just said, listen, nursing school, physician assistant school, chiropractic school, podiatry, allopathic, osteopathic, those are medical schools. Those are, and so we go to school for an amount of time. We do a residency, we do sometimes a fellowship, and then, and then you have certifications, and you just really have to be careful because this is menopause. Although menopause is having a moment, which is fantastic because we need it. It's having a moment because, women are vulnerable in this space and it's being taken advantage of, and you will be taken advantage of if you're not careful. And so it's just so important that you just ask, hey, does this sound right? And listen to that dang gut, and so that those are questions to ask for sure. I want to see your credentials.
What we see all the time is patients come to us who've been to see multiple other clinicians, right?
A lot of money,
like over
a lot of money
years.
Yep.
Yeah. And no one can join the dots for them because I really feel like you need all that extra training to actually join those dots and pull all that information together. Yeah.
And to get rid of your biases, right? Like I had one poor woman that was just like going to the bathroom and using toilet tissue was painful for her. But because she wasn't technically menopausal, her GYN was not going to give her vaginal estrogen.
Right.
Like, can you imagine like feeling like every time you go to the bathroom, it's sandpaper,
No.
or shards of glass? My mouth just dropped. I know we hear it all the time, but it still just is astonishing every time. So, making sure that they need the training to get rid of those biases and those misconceptions that aren't true, And so, in addition to that, I think when you're looking for a menopause practitioner or, clinician, that they can also are well-versed in diet, lifestyle, your screenings that you should be doing, treatments about low libido, painful sex, how to treat those things. How long can you stay on medicine? What are your long-term benefits? Do you have to go off of it? Those are all questions that are easily answered and should be easily answered.
And I think too, because now people are probably like, well, how do I know? Like, I think, asking your friends who have had good experiences, that have, you know, been with providers, that spend the time with them, are finding out, you know, about, you know, their, you know, all of their history, their family history, but then also all that lifestyle stuff. Because I mean, we're not, you know, Rebbecca and I have this conversation. I mean, I'm not a drug peddler. I mean, my whole role is not to just write you prescriptions. It's about helping you prepare for the next 40 years. And so good midlife care involves all of those other discussions, you know, about wellness and, you know, beyond just giving you the hormone therapy. But I think, you know, friends are a good, you know, resource. But I think, you know, if a provider just wants to write you prescriptions, I mean, that's an option, but you're probably not going, you know, to achieve as much long-term wellness.
Right. Same thing we talk about, you know, with weight loss as well. You know, if you're just coming for medications, you've missed the whole boat, which, you know, we'll talk about that, I'm sure, in another episode. But, you know, it's the same thing because it all intertwines with midlife women and giving good care from, you know, the 30% on, if we're lucky enough, the rest, you know, that last 30, 40, 50% of our life. So, all right, Aoife, we got some key takeaways here.
I was just about to make a list of them. You caught me on the hop. All right. Let me try and put it together. So I would say key takeaways would be, number one, educate yourself. We'd said in a previous episode, we have great link trees in our Instagram and we have a lot of articles in there. So go find the one on contemporary management of menopause by Dr. Jim Simon and Dr. Barbara Levy, and read that and bring that with you. Number two would be to get yourself a tracker. So the Balanced Menopause website is free, and you can also download the app onto your phone, track all your symptoms for 2 or 3 months, print it out before you go to your appointment and bring it with you. And number three, make an appointment that is solely to discuss menopause, and check before you go hand that your clinician actually knows how to treat women in menopause. Anyone have anything to add to that?
I agree. Separate visit. We can't, especially if you are seeing someone in an insurance-based model, it has to be separate. They don't have enough time probably to do it enough distance in one visit. So for sure, separate.
And, you know, we'd really encourage you to follow all of us on social media because we share some really great information on there all the time. And our next episode is going to be all about lab work and what you should ask for and what there's no point in asking for.
Yes. All right. Till next time.
Till next time.
Fine ladies, midlife tribe. We'll see you at the next podcast.